Donor selection for blood banking. So the blood donor selection and collection. So we have a selection of potential blood donors, and this involves an extensive medical history questionnaire, serologic testing, which helps to ensure the safety of blood product recipients. The blood collection is performed by qualified and trained personnel, and this happens in designated blood collection centers. There are governing agencies that help look for the processes, including donor selection and donor unit processing. That would be FDA, the AABB, and CAP, or the College of American Pathologists, along with the Center for Biologics Evaluation and Research. For donor screening, this includes medical history, a mini physical examination, and serological testing of the donor blood. We also will have an identification and registration, and this helps to confirm the donor identity and link to existing donor records, and we also need to have a consent to donate is required as well. Screening of the donor helps to ensure safety of the donation for the donor and obtaining donor blood that will not transmit disease to the potential recipient. We also need to make sure a medical history questionnaire is filled out. So a standardized medical history questionnaire was actually developed by a task force that included representatives from the AABB, FDA, and the blood and plasma industries. There is self-administered questionnaires that the donors fill out, and these must be reviewed by training personnel prior to collecting the blood. The questions that are asked for that donor history questionnaire is if they're on any medications, any recent travel, if they've had previous Creutzfeldt Jakob disease, any coagulation disorders, and their sexual activity. For the physical examination, the donor center representative will evaluate the donor. So they'll look at their general appearance, make sure they're healthy enough, look healthy enough, things like that. As far as their weight goes, they need to be at least 110 pounds. Temperature needs to be less than 99.5 degrees Fahrenheit. They'll check their pulse, they'll check their blood pressure, they'll check for any skin lesions, and they're also going to check their hemoglobin level. So for hemoglobin in women, they have to have a hemoglobin greater than 12.5, and for men, it has to be greater than 13, greater than or equal to for both men and women for those values. For informed consent, so the AABB standards mandates that informed consent of allogenic or autologous and apheresis donors has to be maintained or obtained. The donor must be informed of the risk of the procedure and also of the tests that are performed to reduce the risk of infectious disease transmission to the recipient. For autologous donors, so most autologous blood is used to treat surgical blood loss in very specific situations where there is a reasonable opportunity to avoid homologous transfusions and or when compatible allogenic blood is not available. So some advantages of autologous blood is that it includes a decreased risk of disease transmission because they're using their own blood. There's a decrease in transfusion reactions and alloimmunization as well. Some disadvantages of autologous donation, though, is there is a potential for bacterial contamination, circulatory overload, and cytokine-mediated reactions and product recipient misidentification can still happen. A directed donation, so this is collected under the same requirements as an allogenic donors, but is directed towards a specific patient. So the tag for the directed unit is a distinct color, so that way people working know that it is for a directed or specific patient. If the donor is a blood relative, the unit must also be irradiated to prevent graft versus host disease. And then there should be a system in place to ensure that the directed units from the blood relatives are irradiated. So just another double check to make sure everything's getting done and being safe for our patients. For apheresis, so by definition, this is a process for collecting a specific blood component like platelets or plasma or maybe white blood cells while returning the remaining components back to the donor. So the mechanism is the blood is separated using centrifugal force based on the density of each component. The uses, we use this to collect large volumes of targeted components. This is commonly used, like mentioned earlier, for platelets and plasma. Can also be used for white cells, red cells, and hematopoietic stem cells. For donor requirements for apheresis, so generally it's going to be the same as your whole blood donation. However, there are time intervals between donations can vary based on the component collected. For regulatory oversight, the FDA regulates the process. And then the AABB and the ASFA, which is the American Society for Apheresis, can also provide additional standards. For whole blood collection, once the donor has satisfied the requirements of the screening process and has been registered, then the whole blood collection can go ahead and continue. For donor reactions, so during or after blood donation, donor reactions can occur and are generally classified into 3 categories. First one is a mild reaction, so these symptoms may include lightheadedness, dizziness, nausea, or sweating. These are the most common and usually resolve quickly with rest and fluids. There can be a moderate reaction. This may involve fainting or vomiting, and it requires closer monitoring and sometimes assistance from medical personnel. And then we also have severe reactions can occur. They are rare, but they can include seizures, prolonged unconsciousness, or cardiovascular issues. Immediate medical intervention is necessary for these. Patients can also potentially have hematomas, which is blood pooling under the skin due to needle insertion. These are also a common complication. Staff should be trained and prepared to identify and manage hematomas promptly to minimize discomfort and prevent further issues. For donor records have to be maintained by the blood collection facility as mandated by the FDA and AABB. There must be a system to ensure that confidentiality of the donor is not compromised, just like it is when you're in the hospital, and that the donor records are not altered. For donor processing, there are tests that are performed on each unit of blood from the donor, and it should include the ABORH, any antibody screen, hepatitis B and C, HIV, West Nile virus, syphilis, T. cruzi, Zika, and Ebola.